Hi, I am Marie-Christine and I will be talking about the alveolar bone. First off, I will be discussing about the bone in general. Bone is a specialized connective tissue composed of intercellular substances and osteocytes with its processes in lacunae and canaliculi. Bone is composed of 65% inorganic matter, which consists of hydroxyapatite, and 35% organic matter, which consists of 28% collagen and 5% osteocalcin, sialoprotein, phosphoprotein, osteonectin, and bone-specific protein. The bone tissue makes up the individual bones of the human skeletal system and the skeletons of other vertebrates. There are a lot of functions of the bone, and one of these is that bone gives structural support for the mechanical action of soft tissues, such as the contraction of muscles. Bone is also a mineral reservoir whereby the endocrine system regulates the level of calcium and phosphate in the circulating body fluids. Last but not the least, bone serves as the primary site for hematopoiesis, which is the production of all the cellular components of blood and blood plasma. The bone has 4 structural elements, and these are the bone cell, the bone matrix, Sharpey's fiber, and the Haversian canal. There are 3 types of bone cells: the osteoblast, osteocytes, and osteoclast. The osteoblast is a cell that secretes the matrix for bone formation. The osteocytes are simply osteoblasts trapped in the matrix that they secrete. They maintain the strength and health of the bones. Lastly, osteoclasts are a large multinucleate bone cell which resorbs mineralized bone, dentin, and calcified cartilage. Bone matrix is the bone mineralization that gives bone rigidity. Sharpey's fiber are a matrix of connective tissue that connects periosteum to bone. Last but not the least, Haversian canal. These are a series of microscopic tubes in the outermost region of bone called cortical bone that allows blood vessels and nerves to travel through them. Now, let's move on with the histologic arrangement of bones. All bones are a dense sheet of compact bone and a central medullary cavity. The marrow cavity is interrupted throughout its length, particularly at the end of long bones, by a reticular network of trabecular bone. There are 2 types of bones: the compact bone and the spongy bone. The compact bone is a dense bone in which the bony matrix is solidly filled. It has 3 distinct layers: the circumferential lamella, concentric lamella, and the interstitial lamella. The spongy bone is a very porous type of bone. It is highly vascularized and contains red bone marrow. Now, let's move on with the parts of a bone. The circumferential lamella. It encircles the entire bone, forming its outer perimeter. The concentric lamella. It makes up the bulk of compact bone and forms the basic metabolic unit of bone, the osteon. The interstitial lamella. These are the remnants of osteons that were partially resorbed during the process of bone remodeling. It occupies the space between osteons. Osteons are cylindrical structures that contain a mineral matrix and living osteocytes connected by canaliculi, which transports blood. Haversian canal are a series of microscopic tubes in the outermost region of bone called cortical bone that allows blood vessels and nerves to travel through them. Volkmann's canal are small channels in the bone that transmit blood vessels from the periosteum in the bone and that communicates with the Haversian canals. The periosteum is a membrane that covers the outer surface of all bones, except at the articular surfaces of long bones. It has two layers: the inner layer, which is called cambium layer, and the outer layer, which is called the fibrous layer. Now let's move on with the bone formation. Bone formation has three methods: endochondral bone ossification, intramembranous bone ossification, and the sutural bone growth. The first one is the endochondral bone ossification, also called as intracartilaginous bone ossification. It is the process by which growing cartilage is systematically replaced by bone to form the growing skeleton. It is responsible for the formation of the axial skeleton and the appendicular skeleton. The second is intramembranous bone ossification. It is the transformation of mesenchymal cells into osteoblasts, forming the flat bones such as the skull, maxilla, mandible, pelvis, clavicle, and subperiosteal surface of long bones. The third one is the sutural bone growth. It is the intramembranous bone formation at the sutures, producing new bone at the sutural edges of the bone fronts in response to external stimuli such as signals arising from the expanding neurocranium. Sutural bones are very small bones located specifically between the cranial bones of the skull. Now that we know the general things about bones, let us move on with the alveolar bones. Alveolar bones are also called alveolar process. They are specialized bone structures that contains the alveoli or sockets of the teeth and supports the teeth. If the teeth are lost, the alveolar process disappears. The alveolar part of the maxilla is called the processus alveolaris, while the alveolar part of the mandible is called pars alveolaris. The functions of the alveolar bone is that it acts as the anchoring of the teeth within the alveoli. Another one is that it is for the absorption and distribution of occlusal pressures produced by intermittent tooth contacts during chewing, swallowing, speech, and parafunctional activities such as grinding and chewing. Now, let us move on with the structures of the alveolar bone. The first one is the cortical plate. It consists of plates of compact bone in the facial and lingual surfaces of the alveolar bone. It is continuous with the lamina crubriformis at the orifice of the alveoli. It consists of Haversian systems and interstitial lamellae. It is thicker in the mandible than the maxilla, generally greater on the lingual than on the facial surface. The next one is the alveolar bone proper, or lamina crubriformis. It is the area of the bone that comes directly into contact with the root of a tooth or the lining of the socket. It is a hard, compact bone and not soft, spongy bone. In radiograph, lamina dura, which surrounds the tooth socket, appears as a radiopaque line. The next one is the bundle bone. It is a portion of the bone of the alveolar process that surrounds the teeth, into which the collagen fibers of the periodontal ligament are embedded. Bundle bone is functionally dependent in that it resorbs the following tooth extraction or loss. The next one is the spongiosa. It is a part of the bone made up of spongy cancellous bone between the two bony plates and between the laminae crubriformis of adjacent teeth or roots. It consists of delicate trabeculae, between which are marrow spaces filled mostly with fatty marrow. In regions of the maxillary tuberosity and the angle of the mandible, erythropoietic a blood-forming red marrow can be found, even in adults. The alveolar process of the maxilla contain more spongy bone than do those of the mandible. Now, let's move on with the vascular supply of the alveolar process. The alveolar process of the maxilla is supplied by the anterior and posterior alveolar arteries that branch from the maxilla and the infraorbital arteries. The alveolar process of the mandible is supplied by the inferior alveolar artery, which is internal, and the periostal branches of the submental and buccal arteries, which is external. And that will be it for the alveolar bone discussion. Thank you.